What if I told you your Social Security check could automatically enroll you in Medicare? But only if you do this one thing? Don't risk penalties that last for decades. Hi, I'm Naeem, and today we're talking about how Social Security and Medicare work together, and how to make sure you're fully covered. Welcome. If you're 50, 60, or nearing 65, this video is for you. Social Security and Medicare are separate programs, but they interact in ways that can affect your health, your wallet, and your future coverage. Here's what you'll learn today. How and when Social Security handles your Medicare enrollment, how your premiums are paid and deducted, and what options you have, so you can avoid costly mistakes. First, let's quickly define what these programs are. Social Security provides retirement benefits, disability income, and support for survivors. It's run by the Social Security Administration, also called SSA. Medicare is the federal health insurance program mainly for people aged 65 or older, though some younger people qualify through disability. Medicare has several parts. Part A covers hospital insurance. Part B covers medical insurance like doctor visits and outpatient care. There's also Part C and Part D, which cover private plans and prescription drugs, but today we'll focus mainly on Parts A and B. Here's where the two programs work together. The SSA actually manages enrollment for Medicare Parts A and B. If you are already receiving Social Security retirement benefits at least 4 months before your 65th birthday, SSA will send you a Welcome to Medicare packet and automatically enroll you in Parts A and B. But if you're not yet receiving Social Security benefits when you turn 65, you must sign up for Medicare yourself. This is called your initial enrollment period. It lasts for 7 months, 3 months before the month you turn 65, your birthday month, and 3 months after. Some people choose to delay Part B if they're still working or covered under a spouse's employer plan. That's allowed if your employer has at least 20 employees. You can use what's called a special enrollment period to sign up later without penalty. If you don't have employer coverage and miss your enrollment window, you could face permanent penalties. For Part B, that means your monthly premium goes up 10% for every 12 months you were late, and you pay that higher amount for the rest of your life. Let's talk about premiums. Part A is usually free if you worked and paid Medicare taxes for at least 40 quarters, which is about 10 years. Part B has a standard monthly premium, which is around $185 per month in 2025, though this amount can change each year. If you have a higher income, your Part B premium may be higher because of something called the Income-Related Monthly Adjustment Amount, or IRMAA. SSA uses your IRS tax records to decide if this applies to you. If you are receiving Social Security benefits when you enroll in Medicare, your Part B premium will be automatically deducted from your Social Security check each month. If you are not receiving Social Security yet, you will get a bill directly from Medicare that you'll need to pay quarterly. So let's review how timing matters. If you're getting Social Security already, you don't need to do anything. Your Medicare card will arrive about 3 months before you turn 65. If you're not getting Social Security yet, you need to apply during your initial enrollment period. If you keep working past 65 and have group health coverage through an employer with 20 or more employees, you can delay Part B and sign up later during your special enrollment period without penalties. If you work for a small employer with fewer than 20 workers, Medicare usually becomes primary at 65. So you need to sign up then to avoid gaps and penalties. Now let's look at a few real-life examples. Person A is already receiving Social Security benefits at 61. When they turn 65, they automatically get enrolled in Medicare Parts A and B. If they want to delay Part B, they need to follow the instructions in their welcome packet to opt out. Person B is still working at 65 and has health coverage from their employer. They delay Part B and sign up later when they retire, using the special enrollment period to avoid penalties. Person C misses their initial enrollment period entirely and doesn't have employer coverage. They end up paying higher Part B premiums for life because of the penalty. To avoid problems like this, here's a quick checklist. Are you already getting Social Security benefits? If yes, watch for the welcome packet around your 65th birthday. If you're not, mark your initial enrollment period dates on your calendar. Check if your employer insurance counts as creditable coverage. Estimate your income to see if you may have higher Part B premiums. And keep your IRS and SSA records updated to avoid surprises. You can find more details on the SSA website, the official Medicare booklet, or by visiting your local Social Security office. Let's wrap up. Social Security plays a key role in Medicare enrollment and premium collection. The timing of when you apply matters. Missing deadlines can cost you for life, while planning ahead can save you thousands. You've worked hard and earned these benefits. Make sure you understand them so you don't overpay or miss out on coverage when you need it most. If this video helped you, share it with a friend who's turning 65 soon. And leave a comment below what's one question about Medicare or Social Security you've always wondered about. I might cover it in the next video. Thanks for watching. Stay informed, stay covered, and I'll see you next time.